So without wasting much time, I want to confirm if Professor Oluwatoyin is with us here right now.
Yes, I
am. Welcome, ma'am. And all your panelists are here. So I would want to forge ahead, onward and beyond. Now with us here is a colossus, a quintessential of a health worker, a mother and a leader, assistant professor of nursing at Adams State University, United States of America. She's also a member of the Operating Room Global Education and Training Committee. She's an experienced perioperative nurse, educator, and global health advocate, guiding discussions on workforce development, perioperative safety, and capacity building in low resource settings. Please, she would be leading the panel conversation today on strengthening perioperative nursing in low resource settings, the challenges and strategies for growth. Thank you so much, Prof. To give you the floor now, please, you would introduce your panelists and then blow our minds away. Welcome on board, ma'am.
Thank you so much, Dr. Daniel, for the warm introduction. I want to say good morning, good afternoon, good evening from anywhere in the part of the world you're hearing me today. My name is Oluwatoyin. Feel free to call me TY. Most people call me that. It's an honor to be the moderator for this panel this afternoon. I have amazing panelists that I'm going to be introducing shortly. I hope we've been enjoying the program so far, and I'll just get straight to it. Today, this panel, we're going to be discussing something that is very interesting, and we're going to be focusing majorly on strengthening perioperative nursing in low-income resource setting and challenges and strategies for growth and insight from high-income countries. I have about 6 panelists, and I've checked through, and I saw everybody's here, and I'm happy about that. From Nigeria, I have Mr. Sunday Ojekhekpen. I'm sorry if I mispronounce your name, but I tried. I've been trying to say it right. Mr. Sunday Ojekhekpen is the registered nurse, registered perioperative nurse, is the master prepared nurse, and is the director of operation and acting director of Nursing Alliance Hospital, Abuja, Nigeria. Mr. Ekpen Sunday, are you here with us?
Pleasure being in the house. Thank you very much.
Thank you. Good to hear your voice. All right. Next, we have Elis Ivcevic. Elis Ivcevic is a clinical nurse manager operating theater, University Hospital, Limerick, Highland. I'm sorry, I think it's a he. I can see him already smiling. All right. He's also a member of TORG Advisory Board, and he also belongs to Regional Yale Trauma Faculty, Europe and Southern Africa. Mr. Elis. I think you muted. We can't hear you. Okay. I'm sure he's going to get that fixed. I'm going to go to the next person. And the next person all the way from Rwanda, we have Oswald Benimana. She's a master prepared nurse. She's also a medical surgical nurse. She's director of nursing and midwifery services, University Teaching Hospital, Botahe. And she's also the policy and guideline coordinator, TORG Rwanda chapter. So Miss Benimana, you here?
Yes, I'm here.
Oh, it's a sir. I'm sorry.
Thank you so much.
All right. You're welcome. Great to have you here.
Thank you.
All right, I'm going to move to Zambia. We have Miss Lillian Nwape. Miss Lillian Nwape is the president of Perioperative Nurses Association of Zambia. She's also the national focal point person, SADC TEWG. She's a principal nursing officer, perioperative nurse, National Heart Hospital, Zambia. She's also the vice chairperson, TORG Zambia chapter. Do we have you here, Miss Lillian?
Yes, I'm here. Good afternoon, everyone.
Nice to have you here. All right. So the next person on my list is Miss Tryphine Mutyasera, all the way from Zimbabwe. She's a registered general nurse, operating theater nurse, Zimbabwe. She also is an international. She also has an international diploma in environmental management, NIBOSH UK, international trauma life support, ACLS, BLS, and all the AHA certificates. She is also a master prepared nurse, and she majorly has her master's in public health all the way from UK. Do we have you here, Miss Tryphine Mutyasera?
Yes, I'm here. Good afternoon.
Great. Good afternoon. Thank you so much, panelists, for being here. It's an honor to be the one moderating this session this morning. I'll go straight to it so that we don't take much of everybody's time. And I just want you to know that the way I'm going to be asking the questions, the question is going to start from Mr. Sunday, then to Mr. Elis, then to Mr. Oswald, then to Miss Lillian, then to Miss Cassie from Scott, and then from Miss Cassie Scott from New Zealand, and also to Miss Tryphine Mutyasera. So I go to the first question. And this team, what we want to be talking about majorly are the challenges and current realities of perioperative nursing in low resource settings. So my first question to you, Mr. Sunday, what do you think, or what are the barriers? All right. So what are the barriers facing perioperative nurses in Nigeria today, and how are you addressing them at a facility and national level? Mr. Sunday, over to you, sir.
Okay. Good afternoon, everybody. A pleasure being with us today. Yes, funding has become a big problem, especially at the OR, that is operating room, and then for which is the champion. The matter of the perioperative is expected to make sure everything about surgery, especially as it concerns the operating room, are there adequate time, adequate quantity, involved, well integrated to turn out successful surgery. So to this extent, Nigeria can safely say is a low resource income setting based on all parameters. Yes, issues that make the perioperative law, especially as regards to results, would be thrown under six subjects. First is the fact that there is poor funding. If you check the indices regard what is devoted to health and healthcare as far as Nigeria is concerned, you find out that they really far cry. They hardly can meet up. So the small resources that is being allocated is shared and is being scrambled for by all the other sectors in the hospital. So the operating room is not getting as much feedback. Beyond that, you are looking at specialization. Now, being a perioperative nurse, working in the ER, it's okay to be a perioperative nurse, but it's also okay to subspecialize. So being a perioperative nurse is there. What are the opportunities, theoretically and otherwise, to become subspecialists? So that is a problem, because the opportunities available for subspecialization are out of country, and when we put together what it takes to buy or change the typical naira and dollar, the euro and all that, it then becomes a big challenge for the Nigerian. Now, we have a problem which is all over, but peculiar with Nigeria, and that is brain drain. It's not new to know that Nigeria is one of the major exporters of nursing, not just nursing, healthcare practitioners, more so perioperative nurses. Hundreds of these subspecialist nurses travel out of Nigeria day in, day out. And this leaves us now with a large chunk of new entrants into the OR setting, and they're largely I don't want to use the word of brain. Their competency is quite small, while the ones that are having reviewed and these competencies have had to travel out of the country. Now,
Excuse
that,
me, sorry to interrupt, but I'm having trouble hearing you. It's like the microphone quality, maybe. I don't know if others are having the same challenge.
I do not know, maybe internet or something, but
it seems to be the microphone. It sounds far away.
I'm not sure what to do as we speak, so I'll just maybe speak a bit louder and see how that happens.
Thank you.
I do not know if it is any better as we speak. Hello?
Yeah, I'm hearing you, sir.
Okay, so if that is it, we are plagued again with the issue of quackery, the entrance of untrained personnel into the operating room setting. It has become a big challenge. Now, two factors are responsible for that. The fact that the operating room personnel, few ones have traveled or are currently traveling, leaving very few ones. The other problem is the fact that because it's a low income setting, majority of organizations are now looking for a way out to get cheaper labor. And this cheaper labor would mean getting uncertified, untrained perioperative nurses into the operating room. And that is a big setback for us. What is the consequences of this? It takes us to the next one, high workload. Now, because the numbers of personnel that we have is reduced, the workload did not reduce in any way. Instead, it increased because the low income setting we are in has created reason for more people, for more persons to be sick. So patient numbers have increased, but the number of the perioperative nurses available to actually deal with these patients have reduced. So what is the consequence? More work. People have had to bend back and work, and that has become one of the reasons why people are actually going out of the country. So if you look at it generally, you find out that infrastructural setting would mean educational and physical infrastructure. Now, the educational part, we emphasize basically on certification. Now, competency is a big issue here. Most persons, or most trained personnel get to acquire this competency in the course of training. Some persons have said 12 months is too short for the training. Well, I do not think so. But then, the problem that has caused, or that we keep seeing regularly, is that new entrants seem not to be as competent in the dexterity of therapeutic practice and unfortunately what we get. So if we were not in a poor economy, a lot of these things I've talked about would be easily dealt with. The funding is an issue, and if we get good funding, things will not go the way it is. Facilities are available. We have people that have had to travel out of the country, not because of money, but simply because of facilities that are abound in other sectors. We keep talking about minimal invasive surgeries. We talked about surgeries that are high-tech, high-falutin. But I can certainly tell you that these facilities are not widespread. They are very, very sparsely located around the country where this can happen. So, unlike the other areas of the world where things are available because they are high resource. Now, within the country, yes, we have a few organizations that we can say, the director of the international relationship, you can consider them as high income environment. Yes, today we have multiple oil companies in Nigeria.
I'm so sorry, sir. I might have to. Are you hearing me, sir? I may have to ask you to let's round it up so that we can give room for others. We have 45 minutes and we have 2 sessions in this for this group. Thank you. Do you have any final words you want to say before I move to the next person? I don't think he's hearing me.
Thank you very much. It's okay.
All right.
The other
All right. Thank you.
Of the communication would be solution. So
Okay.
I'll keep at that point.
Yeah. Thank you so much. He made mention of so many things: poor funding, allocation, brain drain, quackery, cheap labor, and all of it. And I'm sure we're going to extend more on what he talked about on the other time when we're also doing the other questions in the next round. All right, now to you, Mr. Elis. I'm going to be asking you, from what position from your position in Ireland, what practical lessons can be shared from high-income countries that can help improve surgical nursing system in low and medium income countries?
Hello, everybody. First of all, can you hear me now?
Yes.
Good. Can you hear me clearly?
Yes, we can.
Okay. So I was thinking about this topic, and this topic requires an hour of discussion. So I will just try to summarize my opinion in a few short points, okay? So these are the points: sustainable partnership, accessible training via online platforms such as TORG in this case, adopting competency-based training frameworks, implementing data collection for quality improvement, promoting interprofessional collaboration, decentralizing surgical services to first-level hospitals and so on, promoting task sharing, upskilling, mentorship, and training opportunities to increase the number of specialist and non-specialist surgical and nursing workforce, in this case, nursing, as a speaker about nurses, but also, from my point of view, in Ireland or in any other high-income country, I understand and recognize that I can also learn from low or middle income countries, particularly in fostering communication, coordination between sectors, and development of holistic, community-based care by frontline staff. All these efforts must be collaborative, aligned with countries' priorities, and respectful of local context to ensure ethical and sustainable system strengthening. That would be my answer.
Thank you so much. That was very straight to the point. And one thing that I want to point out that you said that really stood with me is sustainable partnership. Nobody can thrive alone in isolation. We need ourselves. And just like you said, we learn from high-income countries, and then from high-income countries learn from low-income countries. At the same time, low-income countries can partner with high-income countries to learn new things that they take back home to help them as well. Thank you so much. All right, I'm going to move to Rwanda, Mr. Oswald, and I'm going to ask you, how has Rwanda approached perioperative nursing development, and what have been the key institutional or policy level enablers? Mr. Oswald, over to you, sir.
Yeah, thank you so much for the opportunity to present in this conference. And I do really appreciate the commitment and also the support from the TORG to prepare this. The point about how Rwanda has approached the perioperative nursing development, and also what have been the key institutional policy enablers. Rwanda has nowadays the advanced perioperative nursing, and by achieving this, it required partnership of academic institutions and also some international organization. Like now, we are having a specialization in a master's program for the nurses in perioperative nursing, and this was set to address the critical issue of shortage of staff, working in operating theater rooms, and also to ensure that we get trained personnel about the perioperative domain. So like now, from the formal training from the University of Rwanda, College of Medicine and Health Sciences, at the School of Nursing and Midwifery, we have so far 7 cohorts where there have been training of almost 30 nursing in perioperative domain, and this started from 2015. So it required the national commitment in order to improve the healthcare professional training. And also it required, of course, some support from the professional organization, such as Association of Perioperative Registered Nurses, and also the other international NGO. All these efforts were about to build the local expertise and also to promote evidence-based practice in Rwandan context, and to ensure that the patient who are in need of perioperative care get really the specialized care as required. So about the key institutional and policy levels that have been enablers, there is, first of all, the commitment of government of Rwanda through the Ministry of Education and also the Ministry of Health. And of course, the agreement with the teaching institutions where the universities have been able to host those specialization in their curriculums, and also the hospitals needed to make sure that they have the staff to be trained for that. There have been also the partnership with some academia and international organization, as I've said. Like at the beginning, we're not having sufficient trained Rwandan staff to teach maybe into those specialization, and it required to have the partnership between human resource for health between Rwanda and also the America, and then where we could get the experts to come and assist us in teaching those from the first cohort. There was also the focus on specialized training, where like now we are having different disciplines. The perioperative nurses are being trained into different domains. We are having some cardiothoracic, there are those being specialized in neurosurgery, orthopedics, and even the laparoscopic through the partnership from the IRCAD Rwanda. There have been...
I'm going to ask you to start rounding up, sir.
Yeah, from the professional organization, like I've said, like Association of Perioperative Registered Nurse, where some of the students could access the online courses from the leaders from those organizations. And we also embraced the research and even evidence-based practice. And of course, there is now integration of the clinical and the theoretical component into the practical aspects, as now all the students learning
Mr. Oswald? All right, thank you, Mr. Oswald. Our time is fast spent. I'm just going to move quickly to Ms. Lillian. And I don't know, can someone help me with? All right, Ms. Lillian, I'm going to move to you, and I'm going to be asking you, what are the current capacity gaps for perioperative nurses in Zambia, and how is your association working to fill them?
Thank you very much. Indeed, it's good to talk about perioperative nursing because it's the pillar of surgical healthcare. And Zambia has been one of the champions of perioperative nursing for over 30 years. We've had formal training, and we've been the creme de la creme in most of the European, United States, West Pacific, and the Middle East. So our biggest problem has been the out-migration of staff, because most of these developed countries want proficient nurses. And therefore, we've been grappling with staff shortage. Currently, we stand at 0.167% in terms of surgeon nurse ratios, which is supposed to be 1 surgeon to 3 perioperative nurses. And it's the biggest challenge that we have. And therefore, working with the Ministry of Health, the Nursing Council, and through AMREV, we've been able to develop a curriculum so that we can increase the numbers. Currently, we need about 12,000 perioperative nurses to work in the operating theaters with over 500 operating rooms in Zambia. And therefore, it's a mammoth task for us. So we are working in collaboration with the Department of Nursing, and the director has been very, very supportive. We've also introduced the new curriculum for direct nurses to train as perioperative nurses to bridge the gap. And we've also prioritized promotion for perioperative nurses in government recruitment so that we can have sustainable retention. In addition, with the surge of COVID, we've seen an increase in health-seeking behaviors, and a lot of people are coming now as early as possible to seek medical care. And with advancements in surgery, we've seen a sharp rise, which has compromised quality of care. And therefore, as an association, we are working closely to develop standards, to develop a perioperative plan for Zambia, which we managed to achieve through multidisciplinary approach. And therefore, we are ensuring that all the curriculum that has been outdated is reviewed with support of AMREV. We've also engaged key stakeholders, and we are sitting at all policy level meetings to ensure that surgery is well represented and key issues are brought out. Also through networking and collaboration at local and regional levels, we've been able to participate at various forums to ensure that the voice for perioperative nurses is heard. Also, we have a big problem of governance structure. Being few means that you are limited in how much you can expand yourselves in policy issues. And therefore, we are working around the clock to ensure there's a structure for governance structure in the Ministry of Health to ensure that at any level, perioperative nursing advocacy is there, and also technical support. We've also seen poor IPC adherence, which is infection prevention. We've been grappling being in a hot climate, you know, the challenges of tropical climates. So we've had issues of infection prevention, surgical site infections, but because we are few, we are unable to do follow-ups, and therefore remains a big problem. But we don't want to see it as a problem. We see it as an opportunity to develop innovative strategies that will address most of the challenges that we face in terms of sterilization of operating room due to caseload pressures. We've also worked closely with the surgeons. We are training, and part of the training for basic surgical skills, we orient doctors on what is expected, how to scrub, the etiquette in theater, team building, and all that, so that all these problems that we face can be looked into. We are very grateful as an association that we are the pillar for the nursing department. Thank you.
Thank you. All right, I'm going to move very fast to Ms. Cassie from New Zealand, and I'm going to be asking you what leadership organization practices from New Zealand could be adopted to build stronger perioperative nursing team in resource-limited countries.
Yeah, thank you. So there's a few things that stand out for me. I guess the most important thing that I think of is promoting a collaborative decision-making environment. And what I mean by that is, you know, in Australasia, perioperative teams emphasize a collegial, inclusive, team-based approach. So it's an environment where all team members have the confidence and the ability to speak up when things aren't right. And it's all about empowering the team to do that. It's really just helping people find their voices and have the confidence to do that. And I think it's really important to remember, regardless of your role or your rank in the operating theatre, everybody is important and everybody brings something to the table, and everybody's there for the same common goal. From a leadership perspective, I think it's really important to support the well-being and the resilience of the team. And so as a leader myself, I'm all about emphasising that and recognising as a leader the team, you know, ensuring everybody feels that they're okay and open to talk about, you know, burnout, and creating a culture that feels that it's okay and it's safe to do so. And I think, you know, celebrating the small wins, but also being there for each other when things aren't good and, you know, things don't go well is really important. You know, kindness costs nothing, and I think it's a really important thing to empower your team and to have a team that feels safe. And, you know, obviously if people feel safe at work, then they're providing better care for their patients. And just the last point that I sort of thought about for this is, you know, recognising staff that have passion and an interest in certain areas and tapping in on that. You know, there's a lot of people out there who've got, you know, really keen interests, and it might be, you know, quality and safety, it might be infection control, audits, quality improvement, that sort of stuff. So it's tapping into that and people's passions and giving them the confidence and giving them a little bit of responsibility to develop those skills and have a little bit more satisfaction in their roles and what they're doing.
Thank you so much. Thank you. I'm going to move quickly to Ms. Tryphine from Zimbabwe, and I'm going to be asking you, ma'am, how has your diverse international training and ongoing education shaped your ability to contribute to perioperative care in Zambia? Ms. Tryphine, you're muted, and we can't see you too. Okay.
All right. That is in Zimbabwe. Thank you so much. My experience, good afternoon, everyone. Thank you so much for giving me. Can you hear me?
Yes.
All right. Good afternoon, everyone. Thank you so much for the opportunity. My international experience, especially in the surgical, as a part of the team, it has helped me to see things differently. It has helped me to see, especially in the sustainable surgical practices. I have realized that most clinicians, they are not aware that a surgical team, a surgery, it's the most resource-intense department, part of the hospital. And without this knowledge, I've realized that if we are not careful, if we are just thinking that climate change and global warming is contributed by industries, we are just losing it, because healthcare and surgical practices is also contributing. And this gap of knowledge from an environmental and sustainability point of view, we need to do something. We need to work. We need to do our practice in a sustainable manner. And this will contribute to, without compromising patient care. In other words, I'm trying to bring an understanding that environmental sustainability in our areas, in our operating theaters, in our operating rooms, should be considered seriously, as we are having illnesses and medical problems, emergencies that are contributed by the emissions of gases as a result of our actions. And I've realized that from the international platform, that in developed countries, mostly, they are now using disposables, which is we should be minimized as we look into the global warming thing and the emissions that we are causing. And by looking at this from from a nursing point of view or from a healthcare point of view, there's a lot that is needed in case of in areas like energy. How much energy is that are the theaters consuming? How much water is being used? Are we sustainable enough? Are we looking only on the disposables as easy as possible, or we are also looking at the impact? What is the impact to the health? As we know that according to WHO Sustainable Development Goals, it is on the center of WHO to sustainably use resources so that we combat climate change.
Mm-hmm.
Just to add on that, we as health practitioners, we have a role to play. We can contribute better to the impact. We can contribute to combat this carbon footprint. We can reduce it by our actions, by becoming sustainable. What do I mean by sustainable? We are saying we are using resources carefully to care
I'm sorry
for
to
others.
cut you off, Ma. I'm going to ask you to round up so that we can quickly run the second session. Thank you.
Okay, thank you so much. So me, as a operating room nurse from Zimbabwe, my contribution is knowledge. You know, when we share knowledge, when we share experiences within the operating rooms, with this awareness of sustainability, it will change minds, it will change lives, it will change how people see. And it will also promote a safe patient care as well.
Thank you.
That's my
Thank you.
contribution.
Yeah, thank you so much. All the way from Zimbabwe. All right. So we're going to move quickly to the second session. And I just want to say that please, we're going to be having 2 minutes to each person. After 2 minutes, I'm going to come in and cut you off if you're still talking after 2 minutes. So we're moving to the next session. And this session, majorly, we want to be talking, or we want to be focusing on strategic growth, innovation, and leadership in perioperative nursing. All the way back to Nigeria, Mr. Sunday, I'm going to be asking you, what is your vision for the future of perioperative nursing leadership in Nigeria, and what kind of support is needed to achieve it? Mr. Sunday, 2 minutes, sir. We can't hear you. You're muted.
All right. Okay. Thank you very much. I don't know if you can hear me now.
Yes.
Hello?
Yes, we can hear you.
Okay, thank you very much. Way out, considering the things that I listed the other time, it's around 2 things. One, increase in funding because it's already a low resource area. And how that can be done, circumvented, richer or more resource-oriented environment structures with support. This would be through collaborative support and all that. We can visit, just like some guys from Nigeria have to join a training session in Rwanda not long ago. So inter-country, inter-hospital facility of theater collaboration can help in that light. And that's where leadership is nothing completely again. The second thing is that in Nigeria, for example, nothing comes to is being worked with by the Perioperative and the National Nurses Association to improve and see how we can get competency-based training. That is being done, and I know that that's a big step forward for us. Like I said, most persons have traveled because of work conditions. So improving work conditions would also help. Getting call rooms for people on call, as cheap as call meals, these are small things but to go a long way to help. Facilities that have worked in 2 or thereabouts, yeah, these are initiatives that you have to bring in internally, and you know the extent to which you're able to get cooperation.
Thank you so much. Thank you so much, Mr. Sunday. I have to cut you short. I'm sorry. we have to be time conscious. And I'm going to move quickly to Mr. Elis from Highland, and I'm going to be asking you, sir, how can perioperative nurses in high-income settings support their peers in low and medium-income countries through mentorship, training, or partnership? Mr. Elis, over to you, sir.
Can you hear me again?
Yes.
Can you hear me?
Yes, we can. Yes.
Okay. So basically, I thought I was going to finish with something, but I will start with something. So when I started a long time ago, there was no internet, nor enough resources, nor enough colleagues who would help in learning, and every day was a struggle. Now the world is a very small place. We have access to everything we need. That includes access to people who are willing to help. Now, the main points would be virtual or in-person mentorship, evidence-based training programs, and strategic partnerships. Virtual mentorship to provide ongoing support, to support quality improvement plans, and enable case discussions and data use. A low-dose, high-frequency approach, delivering smaller, spread-out learning sessions over time, to develop and deliver evidence-based training programs and fellowships to enhance perioperative nursing skills.
Thank you, sir.
We should engage in strategic partnership with local stakeholders, obviously. We should work with partners to create mentorship programs and create a culture of continuous learning that can be sustained by the local health system. That's basically it.
Yes, thank you so much. Thank you. And we wish you all the best. I know you said you have to leave. We wish you all the best. Thank you so much for honoring our invitation. Thank you, sir.
Thank you very much to everyone.
Yeah, I'm going to move right to Rwanda, and I'm going to go to you, Mr. Oswald, 2 minutes, please. And I'm going to be asking you, what role can perioperative nurses play in surgical system strengthening, and how can we support their leadership development? Over to you, Mr. Oswald.
Yeah, thank you so much. The perioperative nurses, they play a very big role, first of all, through the direct patient care and also advocacy. And this is by provision of comprehensive care for patient before, intra, and also after surgery, therefore improving the patient outcome. Through also ensuring the safety, as we all know, the nurses are the ones who are responsible of ensuring that the safety checklists are really well done in operating theaters. And of course, to anticipate the needs for being the patient and also the surgeons. And secondly, it's about the education and the trainings, being from for the formal, also informal trainings, and of course, the capacity building and the mentorship programs. And lastly, it's about the system-led management and also innovation. And this is through maintaining the efficiency. And this, once it's optimized, it will help in improving the patient outcome, decreasing the waiting time between operations that can lead to the postponement, and also better utilization of available operating room resources, the tables, and so on. And of course, it's about the leadership development through the adoption of evidence-based practice, and the policy development, and also the ensuring the equipment and the facilities are really used, optimized, and also they are ready, therefore promoting the culture of safety. And how does the TORG can support? It's through the targeted education and the research, through mentorship and networking, like this in this conference, and of course through the empowerment and also the advocacy about the perioperative nursing law. Thank you so much.
Thank you so much, Mr. Oswald. Thank you. One thing that I've seen that I've caught across everybody that I've been speaking today is mentorship. Thank you so much. I'm going to move quickly to Miss Lillian in Zambia, and I'm going to be asking you, Ma, what specific advocacy efforts have proven most effective in elevating the profile of perioperative nurses at the national or regional level?
Thank you very much. As we know that nurses are always behind in terms of sitting at the table, and as perioperative nurses, we've said no, we'll take the chair to the table because we know that sharing a cake requires you to be seated at the table. And therefore, our most effective strategy at national level has been to prove ourselves that we are capable of shouldering the burden of surgery. And therefore, for the first time, we have a perioperative nurse as a country representative for surgery. This is the biggest achievement. And we've also shown that through multidisciplinary collaboration, where we sit in every professional association meeting, representing all in various fora, because we know that as perioperative nurses, we can't win by sitting alone. So we sit in each professional sitting that is being held, and we represent the country at regional and international level, where now they are seeing to say perioperative nurses are not just instrument givers. They understand the real issues governing operating theaters. They know what it means to have resources. We are sitting where key decisions are being made, budget allocation. We are advocating in various forums to ensure that there's equitable distribution and also policy that governs all the practice that we do in surgery. So at a regional level, we have not been quiet. It's very hard for perioperative nurses to represent themselves at regional level without having support from the surgeon or the anesthetist. In SADC, Zambia has proven a record and a periop nurse is there. At PASHEF, which is the Pan-African Surgical Healthcare Forum, perioperative nurses, finally, we have a representative. So this is not something small, it's something big for us, because through advocacy, we are able to sell our mandate. We are able to showcase our abilities. Most of us are considered to be with inability, but we are able and capable. It's lack of a sitting place at the table. Thank you.
Thank you so much, Ms. Lillian. I want to move fast to New Zealand to you, Ms. Cassie, and I'm going to be asking you, what opportunities exist for international collaboration to support perioperative nursing in global surgery initiatives?
Yeah, so as Elis said, learning isn't a one-way street. I think we've all got things to learn. We're all lifelong learners. And I think regardless of where you're located in the world, we should be collaborating with each other and learning from each other. And I think now more than ever, in current climate, we've got lots of opportunities virtually that we can tap into. There's lots of networking platforms and lots of many national organisations throughout the world offer free webinars, journal clubs, all those sort of things that people are more than welcome to attend, and people want to share information. People want to collaborate. People want to, do the mentoring and whatnot. And I think being virtual is great because it overcomes geographical and financial barriers. The other thing that I was just going to say is, obviously with the
I think she just went off for I don't know, maybe a network. I'm going to move.
Why the
Oh no, your network was off a little bit. We couldn't hear you.
Oh, okay, sorry. So as I was just saying, take advantage of the mentoring and the collaboration and share ideas, share research, share everything that you want. And people are out there and wanting to collaborate, so make the best of it. Thank you.
Thank you so much. I'm going to move to Zimbabwe to Ms. Tryphine, and I'm going to be asking you, based on your training in public health and environmental management, how can perioperative nurses integrate broader health and safety perspective into their roles? To you, ma'am.
Thank you, Madam. I think there is need to incorporate sustainable surgical practices. It should be incorporated, especially in the operating room theaters. Why? Because the operating rooms activities, they are also contributing to the global warming, like what I have mentioned before. There is need for nurses, surgeons, everyone works in the operating room as a team to be educated and to incorporate environmental sustainability through minimum or economic use of resources, the awareness of energy. What kind of equipment is the operating room purchasing? Is it green label? Water, how are we using the water? So we need the pioneers in the areas of sustainable surgical practices, so that they advocate for purchase of multiple used equipment rather than single use, which will generate a lot of waste. Also,
Okay.
there is also education to nurses and doctors and those practitioners in the operating room on waste segregation. This promotes a minimal use of resources. Economically, we are saying we are being economically productive, and it will benefit the patient and will reduce the consequences and problems that comes with climate change. Thank you.
All right. Thank you so much. I want to say thank you to all our panelists. Thank you for honoring the invitation. Thank you for bringing your knowledge and sharing your knowledge with everyone here. One thing that I've seen that cut across all that we've said, especially for low and middle income countries, are things like brain drain, funding and all of that. And I love the way that everybody has put it to say this is what we're doing to make sure this is sorted. And also love how high-income countries have said things like there should be partnership, learning from low-income countries, what they're doing, what we can do to help, mentorship, and a sustainable partnership. I want to say thank you so much to all of you. Again, I want to take just one question because of our time. If there's anybody that has any question, I'm going to take the question now. Anybody with any question? I didn't see any.
I have a question.
Okay.
Okay, my name is Clotes
Okay.
Aligu. I'm speaking from Port Harcourt, Nigeria.
Okay.
I think they all have really done well. Then coming into the perioperative field, which we all know that we are trying to advance, I want to ask, is there any effort being made of pushing perioperative both internationally, locally, into master's degree, PhD degree? Because if you look at nursing now, nursing is going beyond what it is before. Because if we don't start now as perioperative members and start pushing this specialty into a higher level, we may end up not being anywhere, especially in Nigeria. Let me just say, especially in Nigeria, where we have specialties. Some of the specialties have moved into the university by having masters, having PhD. But like in Nigeria, I'm speaking now from Nigeria, we don't have such thing. And that means that we are also going to lag behind. Now, coming into this as an organization, is there any plan for us to push into the educational system in some of our countries that don't have this course as masters? Otherwise, the perioperative nurses will soon be dumped as a educational certificate or diploma, not into the degree listing. Thank you.
Thank you, Mr. Sunday. I'm going to have you address that question. I know he's a master prepared nurse and is in Nigeria. So, Mr. Sunday, I'll give you a minute to address that, please.
Okay, thank you very much. It's true what you said, but I like to differ a bit. And the reason why I differ is as much as I agree that we are progressing towards educational improvement, yeah, but at this moment we still do not have enough. Several schools do funny things when it comes to the National Military Council accreditation, and we know. So I like to see this from the point of self-development. Take your time, acquire whatever knowledge or skills you can get, up to PhD, and then decide what you want to do. You want to be an academic perioperative nurse, or you want to be a clinical perioperative. So if you consider this, and you know that the knowledge you are getting is yours, and it will help you and the perioperative community, please, I want to encourage everybody to continue this line of academic education. It will do us good. Thank you.
Thank you so much, Mr. Sunday. Let me just add to that I don't want you to see what is happening around you as a barrier for you not getting what you need to get. If you think you need to go to school, get masters that help you with infection prevention and control, for example, to help you with communication and leadership, whatever it is, don't let what is happening around you at the time stop you from getting what you need to get to help you and help people that you'll be working with. All right, I want to say one thing that has stood out for us today is partnership, and that is one thing that TORG and King Faisal Hospital Rwanda is doing at this conference. This is a partnership conference, and I want to say thank you to TORG and thank you to King Faisal Hospital Rwanda for this opportunity for people to come in, bring their knowledge and share their knowledge, and everybody learns. And if there are any other questions, please do well, drop it on the WhatsApp group that you have, send it to someone in the leadership, and it's going to go to the right person, and I'm sure you get answers. I want to say thank you once again to all our panelists. Thank you, TORG. Thank you once again, King Faisal. And over to you now, Dr. Daniel David Otobo. Thank you so much.
Lovely, lovely. Prof, it was really a pleasure. The panel session we just had, very engaging.